Most common cause for joint pain worldwide is osteoarthritis. Remember this fact that osteoarthritis is not a disease, it's a degenerative process. As we have wrinkles, we have graying of hair. Similarly, osteoarthritis is a normal degeneration which causes because of aging. Now, if you look at any joint, there is a very thin layer of cartilage at the end of the bones. These cartilage are very smooth, and that is why they provide a frictionless movement. Whenever we bend any joint, we don't feel anything. That is because the cartilage is very smooth. The problem with cartilage is it is not supplied by any blood vessels. So, any injury to the cartilage becomes a permanent one. If you cut your skin, you don't do anything about it, slowly and surely it will definitely heal. But in terms of cartilage, if there is any injury to the cartilage, it will not heal. Cartilage is also aneural, that is, it does not have any nerve supply. When we move our joints, we don't feel any pain. However, when there is injury to the cartilage and when the bone starts touching the opposite side of the bone, in that case, we start feeling pain. Now, in mild osteoarthritis, there are thin cracks which appear. Patients will have pain only on overuse and not at rest. These are very early stage of arthritis, and if you take an weight-bearing X-ray, you will see a good joint space between the two bones. Now, as the arthritis progresses, the cracks become bigger and then they become patches. Now, the body feels that the bones are weak, so it starts making extra bones. These extra bones are called spurs or osteophytes. Now, these osteophytes are extra bones, and that is why they start impinging or they start rubbing on the tendons, ligaments and capsule, and that is why you start having pain because of osteophytes. Now, in the final stage of arthritis, which is stage 4, the patches are much bigger, and now the bone starts touching the opposite bone, and because the bone is rubbing on the opposite bone, there is pain, there is cracking sound which comes, and some patients at the later stage of the arthritis will have pain even at rest. So if you look at the X-rays, in a normal joint, when you take a weight-bearing X-ray, there is a clear gap between the two bones. This gap is nothing but the cartilage. In stage 4 arthritis, the cartilage is completely gone, the bone starts touching the opposite bone, and that is why we call it bone-on-bone appearance. So what is the treatment of osteoarthritis? You have to remember 3 P's. The first P is physiotherapy. Physiotherapy helps in building the muscles around the joint. We all know that muscles are stabilizers and shock absorbers of the joint. They are load sharing. Whatever load comes on the joint is taken up by the muscles also. So if you have a good muscle strength, the pain naturally reduces. The other important P, the second P, is precautions. You should take precautions so that there is less load on the joint. So suppose you have arthritis of the spine, so you should not lift heavy objects. Suppose you have arthritis of the knee, you should avoid taking stairs. You should avoid sitting on the floor. You should avoid Indian toilet. So these are the reasons why your pain will increase, because you're putting extra load on the bones which are already damaged. Even though I'm a joint replacement surgeon, I feel that physiotherapy and precautions are the most important mode of treatment for osteoarthritis. The third is the pharmacy, that is the supplements, calcium, D3, cartilage supplements. All these act in maintenance of the joint. It is very important to understand these are just supplements. The main mode of treatment is first P, which is physiotherapy, and second P, which is precaution. Now, not every patient who has stage 4 arthritis needs surgery. In surgery, I mean a joint replacement surgery, either total knee replacement, total hip replacement, shoulder replacement, all these. Your arthritis is affecting your activity of daily living, which is ADL. Then only you need a joint replacement when all other conservative treatments have failed. That is, if a patient comes to me and tells me I have joint pain, but I have not done any physiotherapy, precautions or pharmacy, the 3 P's, then even if they are in stage 4 arthritis, I start them on physiotherapy, I give them supplements, and I tell them the precautions that needs to be taken. With these conservative measures, the patient is still unhappy, the pain is not reducing. In those cases only, I suggest a joint replacement surgery to them. So what do we do in joint replacement? We remove the cartilage and we put metal implants between the joint. And if a joint replacement surgery is done well in a good hospital by a trained surgeon, the patient follows all the instructions, and a good physiotherapy post-surgery is done for a month at least, then the results are very good. Nowadays, robotics have also come in joint replacement. With robotics, the accuracy and the precision is much better. The chances of human error has reduced, and it has been seen that with robotic surgeries, the recovery is faster compared to a non-robotic surgery. However, a well-done non-robotic surgery is as good as a robotic surgery. If you have any other questions, please write in the comment section. I'll be more than happy to answer. Thank you.